I think the EMR has a better chance of impacting primary care office, family practice offices than it does maybe a surgical specialty, because ours is so much office-based, service-based, and especially in primary care, we have so many clinical guidelines for disease management, whether it be diabetes, cholesterol, coronary artery disease, and preventive care, again, for the pap smears and the mammograms, colon screens, that a lot of subspecialties don't necessarily have. Clearly cardiology does and endocrinology, but maybe whether it's a neurologist or a neurosurgeon or an orthopedist, there's not those many clinical guidelines there that everyone agrees on. But in primary care, there's a lot. And so for the EMR to have the clinical content involved, for me to standardize that and to make sure that I'm remembering to do things. Again, doctors sometimes think that they can't ever be wrong or forget, but with all the guidelines that I have to think about, I mean, you should see the algorithms if you actually write them out. I mean, it's mind-boggling that anybody gets care that's appropriate, and that's what the RAND studies show, that it's like a little over 50% of people get the quality of care that they need based on the clinical guidelines. And so if that's the case, that's pretty poor. And so the EMR absolutely, in primary care especially, has, at least in the Centricity EMR, has the tools involved for me to be able to forget some things, but then let that not get past the patient visit and make sure that I take care of those at the visit that I might have forgotten otherwise. A great example is when someone comes in for a cold and you hadn't seen them in a year and they also have diabetes and you're just busy, and you can't think past the fact that they just have a cold, but the EMR is reminding you going, hey, they have diabetes, and why aren't they on an ACE inhibitor? Or, hey, you need to check a hemoglobin A1C on them. And totally that would have been something you missed. And that would have been the opportunity you had to impact their care and impact their morbidity and mortality that I wouldn't have had otherwise.